This is the first part of a two-part course in first aid response. Part 1 covers injury emergencies. After discussing basic safety principles and how you fit into the EMS system as a first responder, we will review basic first aid actions for controlling bleeding, amputation, signs of shock, head injuries, neck and back injuries, contusions and bruises, broken bones, dental injuries, burns and electric shock, heat exhaustion and heat stroke, hypothermia and frostbite, snake bite, insect stings, marine animal stings, animal bites, and human bites. Emergency situations can happen to anyone, anywhere, and at any time. First responders in the community are a vital part of the emergency medical services (EMS) system, as they can often reach the scene before the professional responders arrive. The process begins as soon as an emergency is recognized, either by a bystander or first responder, and help is summoned by calling 911. The dispatcher who answers the call will use the information provided to determine what type of professional help is needed at the scene. However, first aid care administered to ill or injured persons by first responders like you can offer valuable moments toward helping that person until the EMS personnel arrive and take over. Before you can provide first aid, you must understand that an emergency exists. It's possible to use your 5 senses to detect unusual sounds, sights, smells, and behaviors that will help you with this recognition. Examples may include the noises associated with a car crash, the sight of a person lying motionless on the ground, a toxic odor, or a person who appears to be confused or unable to move. Whether the situation is common or very unusual, you must first identify the problem before you are ready for the next step. After recognizing an emergency situation, you must decide to take action before you can help. However, it's not unusual for feelings of fear, uncertainty, or hesitation to take over. While these responses can be a natural part of being human, you must be prepared to do what you can to overcome them. Even though you may be unsure of what to do, the worst-case scenario is to do nothing. Preparation and training helps a lot, but realize that once you have called 911, the dispatcher will offer guidance that will help to relieve the fear of doing something wrong. Your fear should not keep you from providing help. If others are already providing care, ask how you can help. Finally, the type of injury or illness can produce some unpleasant situations, including the potential of being exposed to blood or other body fluids. You may have to take a deep breath and focus on the assistance you are providing. The fear of being sued by someone you tried to help in an emergency situation may cause you to worry about whether or not you should take action. However, this is a rare occurrence, and almost all states have laws to protect first responders who use common sense and who act in good faith in their attempts to help someone in an emergency. These are called Good Samaritan laws, and they provide protection to you against claims of negligence when rendering first aid in a reasonable and prudent manner. They were developed to encourage people to aid those who are experiencing an emergency. A lay responder, non-professional, would be protected from financial responsibility unless he or she acted in a deliberately reckless way. Always make it clear to the victim that you are there to help and remain with the person until EMS personnel take over. It's important to remember that every person has the right to refuse your help. At that time, you are relieved of providing assistance. Calling 911 to activate the EMS system is the most important step you can take in an emergency situation. Rapid arrival of EMS is essential to improving a person's chances of surviving a life-threatening emergency or of reducing the effects of an injury. A few outlying areas in the United States may not have 911 service, and emergency services must be contacted via another local telephone number. Be prepared to tell the dispatcher the location and nature of the emergency, as well as your contact information. The dispatcher may remain on the line with you until EMS arrives, so he or she can advise or instruct you on first aid techniques. Once help is on the way, you will need to provide first aid care until EMS takes over. However, you are not obligated to continue rendering aid if a professional responder arrives and assumes care, or if the scene becomes unsafe. It's also acceptable for you to stop if you become too exhausted to continue life-saving efforts, such as cardiopulmonary resuscitation, CPR. Before you can help an ill or injured person, you must make sure the scene is safe enough to provide help. When approaching an emergency situation, you should always ask yourself, is the scene safe? Examples of factors that could cause the scene to be unsafe for you or any bystanders may include traffic, fire, spilled fuel or chemicals, extreme weather, downed power lines, weapons, or confined spaces. If the scene appears unsafe, you should wait for firefighters or police officers to arrive so they can re-establish scene safety before you offer first aid help. One way the situation can be unsafe for you is if there is a chance that you could be exposed to blood, bodily fluids, an infectious disease, or other hazardous condition. An infectious disease is one that can be spread from one person to another. Some infectious diseases cause temporary discomfort and will resolve quickly. Others, such as HIV or hepatitis B or C, are far more serious and are spread by blood-to-blood contact. However, you can greatly reduce your chances of exposure to these types of illnesses by following some basic guidelines. Standard precautions are protective measures that you can take to prevent disease transmission while providing first aid care. This includes the use of personal protective equipment, commonly known as PPE. You may choose to use disposable gloves, face masks, or cover gowns for PPE. You may also choose to use mouth-to-mouth barrier devices like CPR masks with one-way valves that protect the person providing rescue breathing from the victim's secretions. If you do not have PPE with you at the time you encounter an emergency situation, try to avoid touching objects or surfaces that are contaminated with blood or bodily fluids. Finally, always be sure to thoroughly wash your hands with soap and water in the form of brain injury. A person who has sustained a concussion does not always lose consciousness. However, the symptoms of a concussion appear quickly. Whenever a person has hit his or her head, a concussion should be suspected and the situation should be taken seriously. The injured person can exhibit a wide range of symptoms, including headache, sensitivity to light, and confusion. In fact, the injured person may ask the same questions over and over, or the person may not have any memory of the incident. Drowsiness, nausea, and vomiting and blurred vision are other potential symptoms of a concussion. Anyone who has suffered a blow to the head and is demonstrating signs of a concussion needs to receive a medical evaluation as soon as possible. A blow to the head that does not cause a skull fracture is called a closed head injury. In children younger than age 4, closed head injury is the leading cause of death, and it's the most prevalent reason why young people suffer cognitive impairment and physical disability. If a skull fracture is involved, this type of injury is termed an open head injury. The bones of the skull are very hard, so it takes a substantial amount of force to cause a skull fracture. This type of injury only occurs as a result of a violent impact to the head. Elderly people are also at great risk for complications from head injuries. Aging causes the brain to become smaller, creating more room inside the skull for the brain to move around during sudden violent movement like a fall or a blow to the head. Elderly people are more prone to bleeding inside of their skulls because their brains are smaller and the many blood vessels in the brain become more fragile. Bleeding in the skull, or brain bleeding, is extremely difficult to detect and life-threatening. Symptoms of a brain bleed are similar to that of a concussion. Anyone who has a suspected or known injury to his or her head needs medical attention immediately. A person who has suffered a fall, motor vehicle accident, violent assault, or high-impact sports injury is not only at risk of a head injury, but a spinal injury too. Spinal cord injuries resulting from any mechanism can be devastating to the victim. Spinal cord injuries often result in paralysis, so it's important to know how to approach and assist a person with a suspected spinal injury to prevent further harm from being done. The bones of the spinal column, called vertebrae, are normally strong and flexible. One of the primary functions of the vertebrae is to protect the spinal cord. The column of vertebrae has a hollow core where the spinal cord is housed. While normal movement and moderate jarring does not create a risk for the spinal cord, excess force does. Excess force can disrupt the vertebral alignment, placing the spinal cord in a position to be pinched or compressed between vertebrae. Trauma to the back can cause damage to the vertebrae themselves or to the surrounding structures, such as ligaments and discs. Damage to the ligaments and discs leads to shifting of the vertebrae, where the spinal cord and the nerve roots coming off the spinal cord are at risk of being damaged. The most important thing to keep in mind when you encounter someone who may have suffered a back or neck injury is to prevent further damage to the vertebrae or spinal cord. Assume there is a spinal injury present when you see evidence of trauma to the head, especially if there has been any loss of consciousness, if the person complains of severe back or neck pain, if the person has numbness in the arms and/or legs or cannot move them, or if the spine has been oddly twisted or is in an unnatural position. Remember, movement can cause further injury to the spinal column, resulting in permanent disability, paralysis, or even death, so always err on the side of caution. If you are providing first aid to someone you think has suffered a back or neck injury, first and foremost, prevent further damage to the spinal column. Do not move the victim unless he or she is in imminent danger. Instruct the victim to remain still while you get help by activating the EMS system. The dispatcher will coach you on ways to prevent the person moving the neck or back. This is done by positioning yourself at the person's head, grasping the head with both hands over the ears with your fingers extending down the neck and holding it still. If a helmet is in place, do not remove it. You must maintain this position until EMS personnel arrive and take over. The victim may be frightened and anxious, so it's important to provide reassurance. Keep in mind that the victim may have also sustained a head injury as a result of the injury. You would recognize this injury because the victim will exhibit signs and symptoms of concussion. Contusions are soft tissue injuries that do not break the skin. They are caused by non-penetrating trauma to the soft tissues. A common sign of a contusion is a bruise. The force of the bump or blow to the soft tissues causes damage to the soft tissue blood vessels, resulting in bleeding that collects in the layers of the soft tissues and forms a purple discoloration. As the bruise heals, the skin of the contused area will undergo many changes in color and appearance. Simple contusions are best treated with the application of cold therapy. This is done by making an ice pack or applying a commercially prepared pack over the injured area. Cold therapy helps decrease the bleeding into the soft tissues and controls swelling and pain. It's best to put a towel or some type of barrier between the skin and the ice pack to prevent delicate skin from becoming too cold. Leave the ice pack in place for 20 minutes at a time, then remove for 20 minutes before reapplying. Elevating the injured body part may also be helpful if it does not cause the pain to get worse. Heat exhaustion and heat stroke are conditions caused by overexposure to heat. This triggers loss of fluids through heavy sweating, which leads to depletion of electrolytes like sodium, salt, and potassium. Muscle cramping is an early sign of electrolyte depletion, and it can quickly turn into a life-threatening condition if measures are not taken to halt symptom progression. When muscle cramps from heat exhaustion are not addressed by resting and consuming fluids, the condition can progress to heat exhaustion. Heat exhaustion is a form of shock. The victim with heat exhaustion can have cool, pale skin, nausea, dizziness, and headache. When the signs and symptoms of heat exhaustion are recognized in their early stages, they can be reversed. You can do this by moving the person to a cooler environment and having him or her take sips of water or an electrolyte replacement beverage. Loosen clothing and have the person sit in front of a fan if possible. Apply a towel soaked in cool water to the neck, re-wetting it as needed. If the person's condition does not improve or becomes worse, call 911. Heat stroke is the least common of the heat-related injuries, but it's extremely serious and must be recognized right away. Without intervention, the body's major organ systems will begin to shut down, and the victim may sustain brain damage. Signs and symptoms of heat stroke include red-hot skin with a very high body temperature, such as greater than 104 degrees Fahrenheit, rapid heart rate and respiratory rate with weakening of the pulse and shallow breathing, vomiting, confusion or decreased level of consciousness, and possibly seizures. Activate the EMS system immediately when you recognize the signs of heat stroke. Cool the person's body as quickly as possible. Use a water hose or multiple buckets of cold water. If ice is available, make several ice packs and place them in areas where large blood vessels are near the surface, such as the back of the neck, groin, and armpits. Be aware that conditions can worsen very quickly. We have discussed a lot of information about giving first aid in this lesson. The most important point for you to remember is to determine if the scene is safe enough for you to help the victim. After you have determined if the scene is safe and the severity of the emergency, you will be able to determine what actions to take. It's important to remember to activate the EMS system as soon as possible when an injury or condition threatens the life of the victim. If possible, use personal protective equipment to prevent the exposure and transmission of bloodborne conditions. Finally, many first aid measures are routine and work to prevent the development of infection. Remember, you are protected by Good Samaritan laws unless you act in a deliberately reckless way. Make it clear to the victim that you are there to help and remain with the person until EMS personnel take over. Your initial and most effective stop in controlling bleeding is the application of direct pressure over the wound with a bandage or clean piece of cloth. If the bandage becomes saturated, reinforce it instead of replacing it and call 911. For wounds that continue to bleed heavily, such as from a traumatic amputation, apply a tourniquet. Note the time you put the tourniquet on and report this information to EMS. Observe the victim for signs and symptoms of shock, which may include paleness, cool and clammy skin, increased heart rate, and lightheadedness. Have the victim lie down to minimize these symptoms until EMS arrives. People who sustain a blow to the head are at risk for a concussion. Symptoms of concussion include headache, dizziness, sensitivity to light, and confusion. Even if the person did not lose consciousness, he or she needs to receive medical follow-up care. If a person has a head injury, you must also suspect a neck or back injury. The most important first aid measure to remember with any spinal injury is to prevent further movement so potential permanent damage is avoided. Call 911 and keep the person from moving until EMS arrives to immobilize the victim. Accidents and injuries can and do happen all around us. Staying calm and trusting your knowledge will allow you to provide the right kind of help to an injured person.
Before you can help an ill or injured person, you must make sure the scene is safe enough for you to do so. When approaching an emergency, always ask yourself, is the scene safe? You may need to wait for firefighters or police officers to arrive before the scene is safe enough for you to offer help with first aid. Another way the situation can be unsafe for you is if there is a chance that you could be exposed to hazardous materials, blood, or an infectious disease. However, you can greatly reduce your chances of exposure to these types of risks by observing standard precautions and using personal protective equipment, or PPE. The PPE you will need may include disposable gloves, masks, or cover gowns. Barrier devices like CPR masks with one-way valves protect the rescuer who is providing rescue breathing. Avoid touching objects or surfaces that are contaminated with blood or bodily fluids. Finally, be sure to thoroughly wash your hands with soap and water after giving first aid care, and properly dispose of soiled PPE. Stroke is the 5th leading cause of death in the United States. A stroke happens when a blood vessel in the brain is either blocked by a blood clot, causing a part of the brain to lose its blood supply, or when a diseased blood vessel ruptures, causing bleeding in the brain. The signs and symptoms are similar in both types of stroke. Because it is essential for medical treatment to begin as soon as possible, it is important to recognize the symptoms and act right away. Facial droop. The person who is experiencing a stroke may complain of numbness on one side of the face, or the affected side may be drooping. If you ask the person to smile, the mouth would appear lopsided, or the smile would be uneven. Arm drift. Arm drift refers to the person's inability to hold his or her arms straight out, without the arm of the affected side drifting downward. The same arm will also be weaker than the one on the unaffected side. Speech difficulty. The inability to speak, slurring of words, or speech that is difficult to understand is another warning sign of stroke. If you suspect the person may be having a stroke, ask him or her to repeat a simple sentence, such as, "It's raining cats and dogs," to check for problems with speech. Keep in mind that the person may not be able to speak at all. Time to call 911. Finally, the element of time is a vital part of early stroke intervention and treatment. If you come upon someone who is demonstrating any symptoms of stroke, do not hesitate to call 911. Even if the warning signs go away, the person still needs a medical evaluation. When activating the EMS system, be prepared to tell the dispatcher the time of the onset of symptoms, as this is valuable information for the treatment team. Don't delay making the call to 911, even if you are unsure if the person is having a stroke. Other signs of stroke. In addition to the fast warning signs, a person having a stroke may have a sudden onset of the following symptoms: problems walking, change in vision, numbness or weakness on one side of the body, confusion, dizziness, or a severe headache. Again, rapid treatment is essential to getting the best possible outcome. Take if you encounter someone who is experiencing a respiratory emergency. As always, activate EMS by calling 911 for someone having difficulty breathing. If the problems are due to exposure to smoke or toxic fumes, move the person away from the area. Help the person into a position of comfort, which may be to assist him or her to sit in an upright position. Loosen any tight clothing, like collars or neckties. If the person has asthma or COPD, he may have an inhaler he uses for sudden symptoms. Breathing problems can be frightening, so stay with the person and provide reassurance until emergency medical personnel take over. We have seen how many sudden illness emergencies can happen with all ages and types of patients. Emergencies with infants and children can be very stressful and carry a lot of emotion with them, so it is best to have some level of comfort in working with them before an emergency happens. The same is true for older adults, and some of the same techniques, such as speaking in a calming voice and remaining at eye level, are helpful in working with both age groups. Pregnancy-related emergencies can be equally stressful. If you have any doubts about the seriousness of a situation involving a special patient population, activate the EMS system to get expert help on the way.